Hi all of you, those of you who are a PG student and who are in various PG specialities, and if you are interested to prepare for a super specialty entrance examination, I have an interesting story to share with you. Myself, Dr.K.Vinayak Senthil, I am a cardiothoracic and a vascular surgeon and a medical specialist upgrade mentor and a coach. I have successfully trained more than 3.5 lakh doctors for PG entrance examination, and I have trained more than 35,000 super specialty aspirants to get DEM or MCQ'S super specialty of their choice. Of more than 200 interviews that I made with the toppers of NEET SS 2024 exam and NEET May 2025 exam, I have an important observation to share with you. In my observation on interview with the toppers, especially for those who are freshers who achieved successfully a topmost rank or a good rank in NEET SS exam of 2024 or NEET May exam of 2025, when they attempted the first and they got into good results, when I went into them, then I understood their preparation is not just for a short time. They started the preparation to get the topmost rank from the first year of their PG program or from the second year of the PG program. They are working simultaneously along with their PG residency program, and they have been preparing for the PG residency and the learning for PG residency through enrolling with Speed Learning app, and that has helped them to clear the first year, second year and third year successfully. At the same time, they have been preparing for super specialty entrance examination also. Once they plan in such a way that they've been traveling along with the faculties of the Speed Medical Institute, they've been mentored in a way that they are supposed to know what all they need to know for preparation of super specialty entrance examination. They have learned through all this process, and when they appeared, when they are eligible for their exams for super specialty, then they scored a topmost and a good rank. So the preparation, what they did to achieve is not just in a short duration, it was for a very well planned long duration, either for 3 years or 2 years. So, and also I have made an observation from the students who appeared for this exam, and those who are toppers and got a good rank in both the exams, they have worked for minimum of 3 attempts for NEET exam, that amounts to 1.5 to 2 years of minimum, and those students for NEET SS exam of minimum of 2 years or 3 years to achieve a topmost and a good rank. So it gives one information very clear for the last 2 exams. It is that the standard of examination has migrated from the PG exit to the super specialty level, and the competition is also have increased. So the planning for this examination has to happen simultaneously, because this is not like a pre-PG exam. The student can prepare for full time. They will be either in a PG residency or an SR-ship, or will be a consultant as a post-PG. So the time that could be allocated could not be a full time, could be work along with preparation. In that, the time that is required to prepare for this exam, especially for this last 2 exams I want to convey to you, has taken tremendous amount of effort, tremendous amount of time, and well-structured planning and well-structured mentorship program along with the Speed Medical Institute to achieve what they intend to achieve. So my recommendations to you, if you are a PG student, that if you are seeing this video at this point of time, if you are a first year or a second year or third year, kindly register for PG residency program, which could help you not only to get a good rank or a good adequate knowledge or pass in your first year or second year or final year PG program, but it's going to also help you, yes, to learn simultaneously, prepare for the super specialty that you are interested in. So in Speed, the unique mentorship program tells you that you will have to first choose what specialty you wanted to do. I mean, if you're going to be a surgical specialty or a medical specialty or DM or an MCH, in that what you want to do, what is your interest. So when you go to the clinical posting, yes, as particular specialty could inspire you, and you will feel, okay, this is what I wanted to do. First, you will fix that. That is going to be your dream specialty that you want to achieve. That's what is going to drive you through this process, because that is the most important motivating factor for you to go through this process to achieve what you wanted to do. So you need to fix that first. Once you have fixed that first, then you will start working towards it. And my recommendation is you need to prepare. Yes, if you are a PG resident student, you need to first plan to prepare for an NEET exam. The very important aspect of preparing for NEET examination, you are going to learn the specialty that you wanted in depth from the super specialty standard in the textbook through the lecture videos of our faculties. Then what happens is you will also prepare for NEET also. So but NEET exam is all about a PG exit standard. So this PG exit standard will help you, yes. So when you prepare that, the 25 questions or 30 questions are going to be asked of 80 questions in NEET is going to come through your NEET preparation, NEET SS preparation. Then a super specialty standard preparation of one particular specialty that you wanted to do, you're going to do that. So when you give 2 exams, yes, an NEET exam first and the NEET SS exam next, or if the season changes of NEET SS first and NEET SS subsequently, you are going to get a seat of your choice, a good rank or topmost rank in either of this exam. If this NEET SS, you're going to get off your PG exit standard a little more of standard of super specialty, you're going to be well trained through that process and you're going to get in that. In case if you miss that, you will concentrate on the specialty that you already prepared to get in SS, NEET exam. So that of 2 exams or almost 2 seasons, you will be able to achieve what you intend to achieve. So this is how, this is the way, this is the strategy that the toppers or the topmost rank, the people who have got the good rank have used. So I recommend the same strategy for you as well, so that you will be able to achieve what you intend to achieve, and 2 purposes will be solved with 1 solution with speed of a unique blended PG residency for an SS preparatory course. So believe in yourself, be confident that you can do it, and it is possible to do it. And I have personally trained and mentored more than 35,000 students, as I was mentioning earlier to you. I know this process because I undergone this process by myself. And I was not able to do back to back, but the students have an opportunity to do that because of the financial stress. In my family, I have to work, earn, support my family and myself before the PG and after the PG. And then subsequently, I need to accomplish my dream of being a cardiothoracic surgeon. Because there were breaks in between after my MBBS, after my PG, to accomplish a super specialty degree. Because of the time lag, that got me into a severe mental depression, financial stress, mental stress, where my own colleagues, my friends were moving forward, where I was not able to do what they were doing. That got into me more difficult time I have to face. But still, my dream which was there within me helped me to achieve what I want to become, a cardiothoracic surgeon. What a student is supposed to achieve in 12 years of time, my dream super specialty of cardiothoracic surgery I was able to achieve in 21 years. That how much of stress has cost in me, I know what it means. What a dream in a doctor, what they want to achieve and how they want to achieve, I have understood very well. That is the very reason I have specially designed and curated a course for you, in a way that you are not supposed to undergo what I underwent. You are not supposed to undergo the mental trauma and the mental stress that I underwent. You have to cut down your frustration. You need to achieve in a short span of time, at the earliest by planning in advance, so that you'll be able to complete your super specialty and start moving on to your practice, so that you can start being successful in your career in super specialty and also successful financially, and so that you will be able to get on to your dream super specialty of your choice. If you are interested to prepare for super specialty entrance examination during your PG residency program, you can click the link below and register yourself for a PG residency unique blended SS course from Speed Learning app. The exclusive mentorship program in Speed Learning app will enhance your preparation, will help you, assist you and support you to effectively complete your PG residency program, and also will help you to achieve a dream super specialty seat of your choice.